Hello friends and dear students, welcome back to my YouTube channel Assess Pediatrics. My today's topic is in continuation with my previous topic, that is hearing loss. I already discussed with you in my previous video lecture regarding the types of hearing loss, causes and diagnostic measures for the hearing loss or hearing impairment, you can also say. So in my today's topic, I will discuss with you regarding the prevention and management for this hearing impairment or hearing loss. सो आई होप आपको टॉपिक समझ में आए, तो लेक्चर लास्ट तक सुनिएगा। और जो भी मेरे व्यूअर्स हैं जिन्होंने मेरे प्रीवियस वीडियो लेक्चर्स को अटेंड नहीं किया है, सो प्लीज़ वो उन सब टॉपिक्स को अच्छे से सुने सो दैट आपको कंप्लीट एक टॉपिक के बारे में कंप्लीट थॉरो इन्फॉर्मेशन मिल सके। सो लेट्स स्टार्ट विद द टॉपिक प्रिवेंशन एंड द मैनेजमेंट फॉर द हियरिंग लॉस। स्टार्ट विद द टॉपिक प्रिवेंशन एंड मैनेजमेंट फॉर हियरिंग लॉस। इन प्रिवेंशन we can minimize the exposure to trauma, infection and ototoxic drugs, avoid the risk factors which leads to the hearing loss, and wear ear protection to prevent noise-induced hearing loss when exposed to the loud noise. In case of management, in medical management, we can restore the hearing with the help of antibiotics to treat the infection and remove the impacted wax or foreign bodies, Seminolytics for impacted wax and corticosteroids for the inflammation and the treat underlying disorders which were somewhere responsible for causing the hearing loss. We can assist hearing with the help of hearing aids, implantable middle ear hearing devices, cochlear implants, sign language and auditory rehabilitation. Hearing aid is designed to amplify the sound and implantable middle ear hearing devices. Implantable middle ear hearing aids are implanted surgically and which help in improve the sound perception for the patients with moderate to severe sensorineural hearing loss. Cochlear implants are surgically placed electrical devices that receive the sound and transmit the resulting electrical signal to electrodes implanted in the cochlea of the ear. And with the help of sign language, it involves the hand shapes, movements of hands, arms, body and facial expressions. You can see here ASL, this is the American Sign Language. I will discuss with you regarding this American Sign Language in my further videos. Next is the surgical management. Surgery is indicated for conductive or mixed hearing loss to restore the conductive hearing. Laryngotomy and spadiectomy is to be performed, and assisted hearing is profound deafness. In profound deafness, cochlear implants and middle ear implants can help, and tumor excision for acoustic neuroma. Nursing diagnosis: there may be disturbed sensory perception, hearing related to the altered sensory reception and transmission, impaired verbal communication related to impaired hearing, impaired social interaction related to impaired hearing and decreased communication skills, disturbed body image related to impaired hearing and use of assistive hearing devices, ineffective coping related to difficult communication, and deficient knowledge related to care of hearing aid due to lack of prior experience. Nursing interventions: inspect ear canals for mechanical obstruction, remove mechanical obstructions like cerumen or foreign bodies, assess hearing by use of a tunic fork or verbal cues to determine auditory ability at various distances. Speak slowly with careful pronunciation of words, add hand gestures, speak face to face and adjust pitch downward without increasing volume. Introduce assistive devices such as hearing aids, written communication and sign language. Allow patient to verbalize feelings and grieving about hearing loss. So with this, my today's topic, the prevention and the management of hearing loss is completed, and I hope you like the video. And if you want to learn some more topics regarding the pediatric nursing, then please like and share my videos and subscribe my channel Assess Pediatrics. Thank you.